Hello, everybody. I hope everyone's doing well. This is Sadad Mohammed from your Bio 120 class, and today I'd like to present genetics and cardiovascular disease. So, cardiovascular disease is a big concern in my own family, and when I originally set out to do this project, I actually wanted to explore some of my family's history, and along with some doctors that I've spoken to in the hospital, and present to you guys a YouTube video. But while I was creating this video, I had a lot of difficulties, and unfortunately, I wasn't able to put it up the proper way. So I just decided to make some slides so I could just share what I found out. So, what is heart disease? Heart disease is basically, for all heart disease have the root of a coronary heart disease, and it's a disorder of the blood vessels that can cause heart attack. And what a heart attack is imagine a kitchen sink. Now you have all these oils that go into the kitchen sink, and eventually it gets clogged up, so the water can't get through the little pipes. Well, that's kind of like your arteries. And when there's a blockage or plaque buildup in your arterial walls, which is also known as atherosclerosis, there's a restricted amount of blood flow and nutrients that can go to the heart. So that's when your heart gets confused and is in pain, and you have a chance of getting a heart attack. And it's a fact that heart disease is always lifestyle choices. People say you shouldn't smoke, you shouldn't eat beef. All this stuff can create heart disease, but it also has many non-modifiable reasons as well. So, what are the causes of heart disease? A little while ago, I was just mentioning modifiable risk factors and non-modifiable risk factors. Modifiable are the ones that you can actually control. So we all know eating too much red beef or having too much fatty foods, your favorite bagels, your pizza is an unhealthy diet and can lead to heart disease. Physical inactivity, high blood pressure, also known as hypertension, excess weight, those people who are smokers who use tobacco, that gives you an increased risk factor to actually have heart disease because it can clog your arteries. Abnormal cholesterol. Later on, I'm going to be talking a little bit about lipoproteins, and it's very interesting when I was researching that. So, abnormal cholesterol is something that was a modifiable risk factor, and glucose and diabetes, high glucose. Then there's the non-modifiable risk factors. There's age, gender, and family history. Every time we go to a doctor and they're reviewing our files, they always ask us about our family history. And when basically your family has it, there's a high chance you can get it, right? So, how does genetics affect your chances of getting heart disease? Family history plays a huge role in that. Um, Basically, we all know that we all have, even in our own families, even if it's our brother or sister, we know that we all look unique, and our genes are what make us unique. So basically, they affect the way we look, and many times we inherit a lot of these things from our parents. And basically, just as it says in the slide, inherited heart conditions are caused by mutation of our genes, fault in our genes. If one of our parents has a faulty gene, there's a 50-50 chance that we could inherit it. So if we inherit it, then there's a 50-50 chance that our kids can inherit it as well. So genetics does play a huge factor in your chances of getting heart disease. Um, I know in my family for a fact that this is what's been going on, because just around the age of 52 is around when most people get heart disease. And I lost one uncle at 53, and I lost another uncle at the end of 52. So that's pretty interesting. Um, Now, in the past, there was no way to actually find out if genetics was influencing your chances of getting heart disease. And many times people would just say, oh, it's just something hearsay. So now, as times change, technology evolves, we all know we have a lot of different tests now. And what basically genetic testing does is it allows us to look at our DNA to identify differences that could predispose us to developing certain health problems. And while I was researching all the tests, the most interesting test I came upon was a test for elevated lipoproteins that can help determine risk factors for further development of cardiovascular problems. And basically, what a lipoprotein is imagine we all know cholesterol is bad for us, and we get the yearly test to see what our cholesterol levels are and our triglyceride levels are. But we actually don't know what these cholesterols actually look inside of our body. And some of them could be thicker, some of them could be round, and that might be the cause for your clot. And so when I say elevated lipoproteins, many of us with don't have enough health literacy to actually ask our doctors or physicians, hey, can you do a lipoprotein test? But a lipoprotein test allows you to see what these cholesterols and these fats are, and if you have a increased chance of getting heart disease based on what that cholesterol looks like. So that I thought was very interesting, and also how genetic testing works in the family is that genetic testing is first done on family members who have the inherited heart issue. And then the aim of the test is to identify if the mutations are causing the heart condition. Once the mutations are found, other family members can have that same genetic test to figure out whether they have the risk and they have inherited the mutation and could develop heart conditions in the family. Um, and it's pretty interesting how the DNA encoded within us can transfer over, and multiple family members can have the same issue. But while I was talking to the doctors, I spoke to Rajiv Jahar at North Shore LIJ, where I work, and he said that there are a few ethical dilemmas. And going back to like earlier in the semester, I do see how it could be a big problem. The first thing is privacy. We all know that privacy is a big issue, and we might all have that uncle at the Thanksgiving dinner table or aunt at the table that we don't want them to know our business. So privacy could be a big issue, and by testing the whole family, you know, it might come out to somebody. Also, your employers, you might not want your employers to know that you have heart disease. Maybe they won't hire you based on that. Or now with all this health insurance stuff going on with Trump Care, it might be that it's a pre-existing condition. They might see that as a pre-existing condition. So that there's always a lot of ethical dilemmas because you might not want to know just in case it's held against you. And there's always the just because you have the risk factors in your genetics doesn't mean you're going to get the disease. And the fear of getting the disease itself might disable a person's normal functionality. You might think every piece of red beef you have is going to cause heart disease because you're genetically predisposed. So there's always that. So then I looked at it. I said, how do we avoid heart disease? Okay, so obviously lifestyle choices are the best way to avoid heart disease, right? I mean, we know that we have to get exercise. We have to have a balanced level of diet and yearly physician's visits that can help our um, keep our chances low. But there are blood tests that determine the risks, and you can monitor your cholesterol and blood pressure and all that kind of good stuff to see where you are. But I realize with the genetic factor, if you inherit it, there's nothing you can really do to change that, right? We're not gonna There's no like miracle drug that changes our genetics, so we don't have that. But in terms of learning about genetics and heart disease, it's important that we have primary education on genetics and its influence on heart disease and other diseases that will help communities open conversation. So now, earlier when I talked about lipoprotein A, I mean, many times we don't even know what that test is. But there's always that person, right, that's about like super skinny, about 100 pounds, but somehow they have, heart disease. They have a sudden, heart attack. Well, that person maybe is has a high level of lipoprotein A in their blood, and they never just got tested for it. And so when we increase primary education, people start realizing that yeah, there are different options where we can actually monitor our how genetics is affecting our bodies. Um, so the next thing I came up with was very interesting. If you look at this slide here, it says the number one cause of death in the United States is cardiovascular disease, and that more people die of cardio disease than all of cancer combined. That's phenomenal. And in the diagram here, you see that more than 600,000 Americans die of heart disease each year, and that's one in every four deaths in America. And the sad truth about it is that 60% of adults don't know their blood pressure or cholesterol numbers. Um, Coronary heart disease is the most common type of heart disease, and it kills nearly 380,000 people annually. Um, so when I was looking at these statistics, I was looking at how it affects different nationalities, races, cultures, and it turns out more or less between 20 and 23%, whether you're American Indian, African American, white, Asian, whatever you are, whatever your background, um, equally between men and women, there's heart disease everywhere, and it's a big problem. And to understand it, we need to understand our DNA, how our genes work, how what we eat is affected by what's inside of us. And if we take control and we have enough primary education to know how to handle it, we get to this slide. With a healthy heart, the beat goes on. Hope you guys enjoyed my presentation. Thank you for watching.